Hi, my name is Kathy, and today I'm just going to talk to you a little bit about the different movements our bodies make, and I'm using my daughter over there to demonstrate some of these movements. The first one is flexion, a movement that decreases a joint angle, usually in the sagittal plane. For example, putting your hand down towards the ground would be a flexion of the wrist. So as you can see, it's pointing downwards, and she's really stretching her wrist. Extension is a movement that straightens a joint that generally returns a body part to the zero position. For example, putting your hand out flat is an extension of the wrist and hand. So now it's back out flat. So that's an extension. Flexion and extension. Abduction is the movement of a body part in the frontal plane away from the midline of the body. Example, moving your arm away from the body is abduction. And I always think of this as something like taking it away. Adduction is a movement in the frontal plane back toward the midline. So think of this as adding something back. Example, moving your arm back toward your body. So abduction, taking it away, and adduction, bringing it back. Protraction, the interior movement of the body part in the transverse plane. So for example, when you need to stretch your back, moving the shoulder blade away from one another. So her shoulder blades are moving away from one another. And then retraction, posterior movement, example, moving the shoulder blades back towards one another. So protraction, moving them away, and then retraction, moving them back. Circumduction on the end of the appendage remains fairly stationary while the other end makes a circular motion. In other words, moving a limb in a circular manner. Example would be moving your arm in a circular motion while the rest of your body stays still. So as you can see, most of her body is still, and then her arm is moving in a circular motion. Rotation, turning movement of a bone along its axis. Example would be moving your head from side to side. So see, of course, our head is on an axis, so it moves from side to side. That's why we're able to have that rotation. Supination and pronation go hand in hand. It is known primarily as forearm movements, but also foot movements. An example would be if you were holding a dumbbell. Holding the dumbbell upward is supination, and I think of this as sup, like up. So you would have your forearm up and your hand up. Pronation, I think downward. So pronation is negative, so down. So that's what I use to remember that. Dorsiflexion is a movement in which the toes are elevated. Example would be if you were painting your toes, your foot would be up, toes would be up towards you. So the toes would be up towards the ceiling like you were painting your toenails. The plantar flexion is a movement of the foot, so the toes point downward. Example, standing on your tiptoes to reach something high on the shelf, or just dancing around doing ballet or exercising. As you can see, she's on her tiptoes, so that is plantar flexion. Thank you, and I hope this video was helpful.